Hi, everyone. It's Maria Weisbrook with the Wakanda Area Chamber of Commerce. We're joined today with Dr. James Lieber from Advocate Health Group. We're going to talk about arthritis today, which is kind of fun. First of all, I just learned there's a new specialty clinic that opened in Hoffman Estates. Why don't you tell us a little bit about that, and then we'll go into the nitty gritty on arthritis.
Yes, thank you so much for having me. I'm really excited for this talk.
Yep.
I'm Dr. James Lieber. I'm an orthopedic surgeon and specialize in hip and knee replacement, primarily out of the Hoffman Estates location, which is a really beautiful brand new building, and starting the orthopedic division there. So it's been a
Awesome.
great start, but we're looking forward to getting more and more people there.
Awesome. And you know what? I hear about it more and more. So you just hear about people having knee replacement, hip replacement, et cetera. So first of all, what is arthritis? And is that kind of the premise for most people getting those replacements?
Yes, the vast majority of hip and knee replacements are because of arthritis. And arthritis is the degeneration and wearing down of cartilage. So, cartilage is the nice smooth surface that lines most of your joints, that provides padding, cushioning, and allows all your joints to move freely. And when that wears down or degenerates, that's what arthritis is, the lack of cartilage. And that
Okay.
causes pain and stiffness.
Right. And so that can happen from injury and from just old age or wear and tear, right?
Yeah. So the word we use is multifactorial, which just means there are a lot of different factors that go into it. There's a genetic component to it,
Mhm.
but most of it is over time, wear and tear, use of those joints as you get older.
And there's no like magic pill that that can get just get rid of it or make it better on you, right? I mean, I know a lot of them try cortisone and all this stuff, but I mean, you can exercise and do all that, but some things it'll just happen, correct? It'll just
Yeah.
happen.
So,
Yeah.
so there are a lot of things we can do to mitigate the pain, to help the
Mhm.
pain that arthritis is causing. But there aren't really interventions that can, from a degenerative arthritic standpoint, replace the cartilage once it's gone.
Okay. All right. Darn it. So, what are non-surgical options?
Yeah. So there are a lot of non-surgical options. We always like to start with the easy things. Start with physical therapy to help strengthen the muscles around your hip or your knee to offload those joints. There are medications you can take, anti-inflammatory medications to decrease the inflammation and pain that arthritis causes. Simple over-the-counter options like Advil, Aleve, and then we also have stronger prescription strength medications like Celebrex and Meloxicam in our also arsenal we can use as well. And the strongest non-surgical treatment for arthritis that we have are direct injections into the joint, most commonly steroids. And that takes a different type of anti-inflammatory medication and puts it directly into the joint to help decrease the inflammation and pain.
And you kind of throw all that at it first, or is it kind of like the plan to just mitigate it for a while until it has to come to a replacement?
It depends on the patient and what the
Mhm.
patient wants.
Okay.
All those are all the options, and some people, it kind of depends on what kind of person you are. So some people
Mhm.
walk in and they say, "I want the kitchen sink. I want everything."
Mhm.
Try that, and some people much prefer to kind of slow roll it. I think it depends on how severe your X-rays are, how severe your symptoms are, and kind of honestly what type of personality the patient has, what they want.
Okay. So your job is different every day. I kind of love that kind of stuff. Recovery. So now I'm hearing people literally sometimes leave the same day. Is there outpatient type?
Yes. So
Okay.
not all, but many patients are hip and knee replacement have become an outpatient surgery, same day, you go home the same day. You can put full weight on it immediately after surgery. You work with therapy to kind of progress. Um, but there's been a huge push to get people home and get people moving very quickly after surgery.
Right. No, and I mean, I just remember a long time ago, not even a long time ago, where it was a lengthy process and not that great. And now people are just they're so happy they had it done and all that other good stuff. So I guess that's my next question. Because of technology, that's made it better, right?
Yeah. So there's been a lot of changes in hip and knee replacement over the years. For me, I think the greatest change is not necessarily the most exciting change, but it's the change in the materials and the
Okay.
manufacturing of it. So if we were having this conversation a long time ago, I'd be saying, well, hip and knees, we think about 10 years, give or take, it's going to last. Then the plastic's going to wear. We might
Oh,
have to do another surgery to swap that piece out to give you more lifespan on that joint. With the changes in manufacturing, the change in the way they make these materials, that's just not the case anymore. And the expectation is that even if you're getting these joints at a younger age, that they last you your entire life.
wow. Seriously. That's really incredible, actually. So, um, activities after knee and hip replacement.
Yes. So I tell my patients after they're fully 100% recovered after surgery that they don't have any activity restrictions. There are definitely going to be higher risk activities that may increase your risk of causing some wear on that joint or increase your risk of feeling some pain. Anything where there's pounding on those joints, things like running, jogging, and jumping. That being said, that's not a restriction. There are plenty of people that get joint replacements that are high demand, highly active, that do some pretty serious activities, things like downhill skiing,
Wow, that's
can do
awesome.
with joint replacements.
That's awesome. And so I guess the suggestion always is to consult a doctor, your doctor, you or a doctor sooner rather than later, just to see what the options are
Yes,
and get a
it
game
doesn't
plan.
hurt. Yes, it doesn't hurt to come in, get an X-ray, see if your pain is from arthritis or from another cause.
Mhm.
And if it is arthritis, as we've kind of talked about, there are a lot of different options, a lot of tools in our toolbox we can use to help your pain.
And there's other reasons for hip and knee replacement, of course, right? Not just arthritis, but is your focus that arthritis or is it everything?
Everything involving hip and knee replacement, the vast majority are going to be arthritis.
Mhm.
There are some very specific cases of different disease processes that would necessitate a hip or knee replacement. Things called AVN, avascular necrosis, which is lack of blood supply to the bone, causing some pockets of dead bone that might need a hip replacement.
Mhm.
Uh, Things that may be from injury, people fall and break their hips,
Mhm.
sometimes leads to the necessity of a hip replacement. But the vast majority of people, especially people that are coming into clinic, it's going to be arthritis.
Okay, I got one weird question. I told you I might throw something at you. Are there other parts that you fully replace?
So, for myself, my practice, I focus on hip and knee.
Okay.
There are other joint replacements that you can get,
Okay. All
things
right.
like shoulders and ankles. But for those, everyone kind of has their lane.
Right.
So, hip and knee, I
Okay,
did
that's what you're in. That's your lane.
Yeah, I did my
Okay.
fellowship in hip and knee arthritis and hip and knee
Okay.
replacement to focus on
Okay.
that. And there are foot and ankle specialists that do extra training just to do things like ankle replacements, and shoulder upper extremity specialists that do extra training just to do specific things like shoulder replacements.
Okay. Thank you very much. Okay, so how do they reach you? Where do you work out of? Give them the
Yes.
backstory on that.
Yeah. So our main office is the Hoffman Estates location. We're opening up in 2 weeks, Lake Zurich location. There's a really good advocate primary physician presence there, and the orthopedic department is going to start having a presence there in a few weeks. And
Okay.
then um, all my surgeries done in Barrington at Advocate Good Shepherd. And
Okay.
the best way to reach out is just to go on our website. If you just Google my name, Advocate James Lieber, it will pop up, and you can call to schedule an appointment, or you can schedule an appointment online. The number is 847-685-4646. We got a great staff there that will help you get seen.
I'm a huge fan of Advocate because they support the community and they do all these great relation building projects. So I'm super happy to have you on today, and thank you very much. I learned a lot.
Thank you. That
That's
was a
what
lot of
it's
fun.
about. All right, we'll see you soon.
Thank you.
Bye bye. And it was 9 minutes and 48